My name is Andreas Neubauer. I'm the director of the Clinic for Hematology, Oncology and Immunology at the Philipps-Universität in Marburg. Our goal is to combine state-of-the-art patient care with immunology and molecular biology research, translational research.
My name is Andreas Burchert. I'm Deputy Director of the University Hospital, the Department of Hematology and Oncology here in Marburg. The Department of Hematology and Oncology consists of the CLC, the Carriers Leukemia Center, and a general oncology department where we treat all types of cancers. The focus is treatment of leukemias and lymphomas, and especially the bone marrow transplantation program is very strong at CLC.
My name is Ulrich Sachs. I'm Associate Professor for Clinical Immunology and Transfusion Medicine, and I'm the Medical Director of the Department of Transfusion Medicine at the Marburg site of this hospital. On one side, we are providing all blood products required for the treatment of patients in this hospital, and on the other side, we are providing all the laboratory services associated with the release of blood components to the patients in the hospital.
My name is Alexander Müller. I'm part of the nursing team at the Carriers Leukemia Center in Marburg. The main tasks of our team are the prevention of infections for our patients, the psychological and emotional support, management of the extensive drug regimen, and the management of side effects and complications.
There are three lines of interaction between the Department of Transfusion Medicine and the stem cell program. Number one, we are harvesting the stem cells from both the donors and the patients in the autologous setting. Number two, we are providing the stem cell patients during the critical phases and with the red blood cells and platelet transfusions they require. And number three, should the patient develop graft versus host disease, which is rarely the case after a stem cell transplant, we are providing extracorporeal photopheresis.
A stem cell transplantation is a very intense type of treatment. What we are doing there is eradicate the patient's own bone marrow, including residual leukemia cells and lymphoma cells, and we try to establish a new immune system and a complete new hematopoiesis in these patients.
My name is Cornelia Brendel. I'm a physician and I'm head of the Department of Hematologic Diagnostics. In our clinic we have three main laboratory branches. First of all, we have cytology, we have flow cytometry, and we have molecular diagnostics. Mesenchymal stem cells are somatic stem cells that can be easily expanded ex vivo. It has been shown that mesenchymal stem cells can be sometimes of value if we give them in a prophylactic manner to avoid severe GVHD reactions, which can be lethal to the patient.
My name is Gabriele Jacques. I'm the head of the stem cell laboratory and I'm the quality manager. In the stem cell laboratory of the CLC, we prepare different stem cell products, one of bone marrow and of blood for autologous and allogenic transplantation. We have therefore to ensure, after processing, a safe storage of the products and supply of the therapeutic stem cells to the clinic. This processing is under strict quality control. The role of the quality management program is to ensure that procedures are being carried out in line with agreed standards with participation of all staff members. JC certification means the abbreviation of the Joint Accreditation Committee of the International Society of Cellular Therapy and the European Society of Blood and Bone Marrow Transplantation.
JC accreditation has mainly established well-organized interfaces between the Department of Transfusion Medicine and the Department of Hematology, which, for example, include weekly meetings with the Department of Hematology and daily interaction between the transfusion department and the wards to provide adequate support in platelet transfusions for the patients.
Patients that are treated at the CLC benefit from new treatments that are specifically available only at the CLC that can be given within clinical trials.
I see the future that we even try to more perform translational and molecular and immunology research. In this department we have a high percentage of patients going into clinical trials, but it's only 50%. We want to have it at 80%. and of course do molecular research which sorted leukemia cells to understand the progression of leukemia even better.